If you suspect that you've been a victim of medical malpractice, normally we want to wait and see a little bit to see how you recover from your injuries. We want to know, unfortunately, if this is irreversible, which a lot of times it is. And if it is, then you should not be shy about reaching out for help to try to get your questions answered. We have a full-time nurse paralegal at our firm. There's a full-time nurse who knows the medicine, as do we, from the years of experience that we've accumulated in all sorts of areas. And so our team likes to get on cases early and review the medical records first, because the medical records are going to form the basis of if you do or don't have a claim. And so what we would ask is that you take it seriously, and sometimes we have you get on your portal to access those, because you can now, in the days of electronic medical records, access your records very readily yourself. The main step is to tell your story. So the more communication we have with you, contacting us and letting us communicate with you so that we understand your story, what you feel was done wrong and how it's affected you, that's important. But you also have to be patient and understand that these cases are very, very expert intensive, and there's lots of different defenses that apply to them. And so you have 2 years to bring a claim. We like to have the medical records within the first 6 months once we know the injury's established, and we want you to continue to treat your injuries and try to get better. Getting those records, and a lot of times it's getting the diagnostic studies, and so we'll need to get the actual original testing that was done, any lab work that was done, any pathology that was done, and then we got to really get a treatment team, almost a secondary treatment team, not to treat you to get you better, but a treatment team that's really looking at the medicine and looking at your ailments and connecting the dots. So that takes a while to get those appropriate experts involved to review each and every step of what we have a burden to prove. And we really have to prove there was what's called a deviation or a missed diagnosis, a missed treatment, some deviation from what the standard of care is. And then that has to make a difference. That deviation has to cause an injury, and it has to significantly impact what you had done, or what went wrong. And so if we can't establish the causation part of it, that, did it make a difference part, that sometimes we have to look at first before we can even look at, well, was there a failure here? Something that was missed, or something that was omitted, or something that was done inappropriately. And then we, of course, will look at, how has it affected you, the damages and the different areas of damage. But the most important thing you can do is to tell us your story. If you suspect that a doctor or a hospital or a medical provider did not provide you appropriate care, reach out to us, let us understand what you suspect is happening, and let us access your medical records so we can take a deep dive into them.